Hello, everyone, and thanks for joining us today's webinar, Cyber Incident Readiness and Best Practices for Healthcare Providers. I'm Nick Essner, Head of Cyber Solutions at Cygnus. For today's webinar, we have brought together two industry specialists who I have had the pleasure of working with both through Cygnus. First, I'd like to introduce Jeff Bird, Cybersecurity Program Leader at Marsh. Jeff, would you like to introduce yourself?
Hi, Nick. Hi, Rebecca. My name is Jeff Bird, currently Senior Vice President at Marsh, where I advise clients on cybersecurity program strategy and resilience. Prior to Marsh, I focused on the healthcare industry for 12 years, including CISO and consulting roles across both payers and providers.
And to our special guest today is Rebecca Kennis, CISO of Arnott Health. Rebecca, would you like to introduce yourself to the audience today?
Yes, hello. I'm Rebecca Kimis. I'm currently the CISO at Readiness. I've been working in the healthcare IT industry for 30 plus years and have migrated into the cybersecurity world in the last 10 years or so. And I'm very excited to have this conversation.
Great. Thank you, Rebecca, for joining us today. As we kick it off, to those of you that are participating in today's webinar, please submit your questions as we go through the webinar, and we will be answering your questions at the end. So as we get started here, I want to kind of set the stage here from a threat landscape perspective. And as we all know, from whether we've been personally impacted at our organizations or just reading the news, we know that this year in 2024, we've seen an uptick of the number of cyber attacks, specifically ransomware incidents that have been targeting the healthcare industry. And so part of today's discussion, we're going to deep dive into those critical components of incident response preparation, building resilient cybersecurity programs and capabilities, and then how we're addressing the evolving landscape of maintaining privacy and compliance in parallel to these challenges in the threat landscape. So I want to kick this off with starting with Jeff. From your domain and how you look across the industry, what is noticeable to you this year as it relates to the healthcare industry?
Yeah, thanks, Nick. Look, the healthcare cybersecurity industry is more mature and collaborative than ever. That's the good news, right? CISOs and healthcare organizations are collaborating through forums such as the Healthcare ISAC, which is an Information Security and Analysis Center. More and more CISOs and cybersecurity programs are coming together to share information. The Department of Health and Homeland Security established the 405D program several years ago that continues to thrive and provide resources for organizations in the healthcare industry. So progress is good, and we should call that out. The industry has made a lot of progress over the last several years. Challenges obviously continue, as you noted, Nick, because healthcare continues to be a very attractive target for cyber threat actors. They're opportunistic, and they're looking for opportunities to exploit organizations. And so healthcare typically has had lower maturity and resources compared to other industries. As I mentioned before, that's changing. Healthcare is catching up, which is a good thing. Healthcare has a lot of complex environments. We saw with Change Healthcare, right? The interconnectivity and complexity of healthcare really brought the industry in some ways to its knees, and there's been a lot of fallout from that. And then obviously healthcare has a treasure trove of data and information. So a lot to think about in a hospital or healthcare, whether you're payer, provider, life sciences company. Ransomware is still occurring, and obviously, what hits one hospital system will typically hit others. So those sharing forums and collaboration are definitely key.
Thank you for that, Jeff. Now, Rebecca, pivoting over to you, kind of similar question. How does this relate to you as being responsible for cybersecurity at Arnott Health? What are some of those top of mind challenges that you're seeing?
Yeah, I mean, as you both alluded to, there's been a very large uptick specifically in healthcare areas, but really overall in across the industry. And a lot of it is because the instances of social engineering attacks, phishing attempts has markedly increased really a lot since like 2019, 2020, and it's continuing to rise exponentially. And you take the technical tools that we have to try to mitigate that. Like we have the email filtering tools and all of that to try to combat that. But even the best tools really only catch like 90 to 93% of those that are sent through. So you extrapolate that out to the number of emails that people receive in a day and the number of people that have email accounts. There's still a number of those phishing emails that are going through. And where they're going to not just the IT department, they're going to who you would expect would have maybe a higher rate of trying to identify these phishing attempts. But they're going to everybody in the organization, and they're getting better and better. And the people that they're going to need to have the education to be able to try to recognize when there are these attempts and, how do I identify that it's a phishing attempt? Used to be you could count on, was there a lot of grammar mistakes and, all of that. But with the advancement in generative AI, it's making them much better, much easier to be to be believable, if you will. So it's much easier to just say, "Oh, okay, you need me to go and check on my W-2. Like, go ahead, I'll do that. I'll put in my social security number. Do I trust you?" Um, so so it's really the onus is on me to try to make sure that everybody in the organization has some understanding of what to look for. And then on top of that, we want to build the culture in the organization to say that, somebody makes a mistake, they click on something they shouldn't have, that they're not going to just sit on it, pretend that it didn't happen, that they're going to have that trust in us that they can report that right away so that we can then try to mitigate it and try to, have a good response to this incident and have it time.
Yeah, you bring up a really good point about phishing and the attacks getting more sophisticated, obviously with AI. But you bring up a really interesting point that I hadn't thought about is around culture, and that culture also goes into the first thing I think about is security awareness and training. What are some of the tactics that you've seen successful that you've rolled out that to build that culture and awareness across your user communities?
Yeah, I mean, of course, there's the regular phishing tests. You have to make sure it's with anything else, so you need to build it, you need to practice it. So they need to see examples of it, be tested on it regularly. We send out campaigns once a month to the employees, and they are fully randomized, so that anybody could get anything, and you're going to get the same as your neighbor, so that you prevent that gopher effect of, hey, I got this, watch out for it. Which in the real world is a good thing, but that doesn't help to train people. And then we also have developed um, some gamification of it as well. So we we want people to, if they find an email that they suspect is phishing email, we want them to report it. We don't want it to forward it as an email. We don't want them to delete it or anything. We wanted to use the tools that are provided in Outlook or whatever email platform you're using. Want them to use that tool to alert the information security team to say, this might be something. So what we've done is we have a monthly drawing of everybody that has reported a suspected phishing email, whether it's one that we've sent them or for a test, or one that's a real life scenario, and we put them in a drawing, and everybody gets, not everybody, but a winner will be drawn each month and get a gift card. So we want to try to encourage the good behaviors and draw them in to that. And the trainings that we make, they're also very short. We make them regular. We have them, we provide trainings every month through our organizational tool that we use. And then, but they are very short. So they are like 5 minutes, 8 minutes, so that it's just a quick get in there, get out, and it's not you're going slogging through a PowerPoint and then doing a quiz. It's a game, or it's a quick funny video or something else that captures their attention, and you're more likely to retain those things. When you have the once a year training, you're doing it as, this is check the box. I want to make sure that I get this done, because if I don't, I'm not going to get my raise, or it's going to show up poorly in my evaluation. So you're doing it just to get it done, and you're not really paying attention to what you're doing, and it's not going to retain it. So by doing this in short bursts throughout the year, the hope is that they will have more frequent touch points with information security and the information that they need to be able to protect themselves in the organization.
That makes sense. And I really like how you emphasize that those quick, short touch points. So it's just not that once a year, oh, God, I need to get through this now and then get on with my job. So, I mean, a lot of this education and awareness really comes down to like preparation, as I would say it. So, Jeff, from your perspective, like, what types of conversations are you having with your clients around a preparation strategy, or how do you bake in cyber readiness into into programs?
Yeah, Nick, I agree with what Rebecca said around education and training at all levels of the organization. That's obviously key in making sure it's tailored to the role. In terms of a broader resilience program, right, we like to think of it as, and in my experience, it's really being prepared for a variety of potential business interruptions, right? Ransomware is the most common one to talk about, can be the most impactful, but there's still data theft occurring, and there's obviously IT failures occurring, like we experienced with the CrowdStrike outage across many organizations. So resilience is a broader topic organizationally than just a cybersecurity incident. It's about preparing for outages in the IT environment. And what we think about when we think about resiliency, it's really working backwards from the question of what's required to sustain business operations, right? What are the people, process, technology components that go into being resilient to support critical business functions? So, for example, a payer might ask themselves, what are the systems that are critical or required to support claims processing? Once you understand an answer to that question, you can work backwards into what the IT and cybersecurity teams need to prioritize in terms of proactive controls and resilience processes and technologies. In a hospital setting, and Rebecca would love to hear your perspective on this as well, the questions might be around what are the systems required to support safe patient care in a labor and delivery unit or an emergency department. Wherever that context is, it may change the answer to the question. I think that's step one, is recognize that it is an organizational program around resilience and should be owned and operated and driven at the organizational level as a collaborative team sport.
Absolutely. And if I could just add on to that, I would definitely highlight and underline your point in that is something that needs to be owned by the business of the organization, and not information security. So information security does what we can to prevent and to, if there is an incident, to recover from that. But what happens if there is an event really needs to fall on the business, as far as being able to be prepared for the what if, what happens. And, need to really make sure that you get in front of the stakeholders and have them really think about, not only what does this mean if our most used system is no longer available, but then what are we going to do after that? And how are we going to make sure that we know what we're doing after that? Many of the younger employers or employees have never worked in a paper system before. All they know is working on a computer system, and it's a good problem to have. But with the high or low downtime rates, high uptime, they don't really get that practice that happened when I started in the industry.
So, Rebecca, that's interesting. So, something that just popped in my mind here as we're kind of talking through this is, there's a lot of things that we're working on that perhaps that we're controlling within our cybersecurity program, our resilience systems in our organization. But change really changed elements from a perspective of impact to a upstream provider, and we could expand this out to supply chain, third party incident management. When you have a vendor that is impacted from a cyber event, and then how your organization is impacted downstream, how do you account for that? How do you plan for that?
Well, that's a really big one, especially this year, and it's getting bigger and bigger. The most of the incidents that have been happening this year, it seems, have been from the third parties, or getting into the third parties of the third parties. So, there's a lot that you really need to do to try to vet out the third parties that you're using and the third parties that they are using. And if not vetting out their third parties, holding them to the same standards of making sure that their third parties are keeping a good security program going. So, there's a lot in third party management where you need to try to do preventatively some of those things. Um, Maybe putting in some language in the contracts, holding them to certain standards. And obviously everyone does the questionnaires, but the questionnaires are only so useful and only so successful because uh, everyone thinks that they have a good program. So they're going to say, yeah, I'm doing this. I'm sure that if Change had filled out a third party questionnaire, they would have said, yeah, we're good. And nobody would have questioned it. So it's really about then getting back to the resilience. What do you do when something happens with a third party? First of all, you need to make sure that you can kind of follow the data. And it's easy for you to know, all right, Change had an incident. Does this impact us? And, the first thing you go and you do is you look at your contract list and hey, we don't have a contract with Change. So phew, we're good. But you then look and you say, okay, well, even though we don't have a contract with them, our um, our third party does. So that's going to then impact being able to submit claims and or receiving the funds back. So there's a lot of downstream consequences, and you need to be able to have a good outline plan and perhaps some redundancy in some of these high priority and critical systems where you can then call on a backup provider to be able to do certain things, and have within your incident response plan, tailored down to specific types. There's of course the ransomware, which is, the big elephant in the room. But there's other kinds of incidents that can be maybe not as impactful, but very impactful to an organization. And make sure that you have those plans that are fully detailed and where you can get to them, and you know where they are, and they have enough detail in there to be able to follow and be able to bring things back online, or bring something else back up online if you need to, and make sure that you have all the context that you need in there. And where possible, have like an off-band, out-of-band solution where if something happens to your environment where you can, it's not impacted by that. If we rely on communicating through Teams and keeping all of our incident response plans in there, and something happens to our network and we have to shut down access to Teams, that's not much good to us. So, between having it available to us and then being able to practice that so that it's, you're building up that muscle memory. So again, it's a different scenario, but it's handled in much the same way that you would any other incident response.
Jeff, I know this cyber resilience and looking at the supply chain is near and dear to your heart. What's your thoughts and what would you like to share?
Yeah, look, Nick and Rebecca, I think Change Healthcare, the silver lining around that is that it brought awareness to the interconnectedness and complexity of healthcare systems across organizations. And so, you know, I think one way to look at this is that cybersecurity leaders, such as Rebecca and CIOs and others that know the technology landscape, have known this for years. We've known that healthcare is a complex environment to manage, and it's difficult to manage. I don't know how well known that has been amongst business leaders and board members. And so, if you're a CFO or a general counsel or some other business non-IT business leader, the invitation and encouragement from the IT side of the house is to get curious and engage with your CIO and your CISO around your technology environment and how dependent it is on third parties, and come up with strategies together to help mitigate the risk that something like Change Healthcare could present to you. If you're a CIO or a CISO on this webcast, reach out to your leadership and engage in the conversation. Continue to try and educate them on the complexity that you have to manage on a day-to-day basis. That conversation around third parties, reliance on vendors, can be a really nice platform for engaging in resilience more broadly, especially with Change Healthcare really on people's minds. So I think that's the invitation, is to really use third-party risk management as a way to engage and build a resiliency plan.
Right. And so I want to connect two things here. So Rebecca initially said, you mentioned gamification, and my ears perked up. And then Jeff, you said around engaging with the board, the C-suite, and there's that awareness and education that goes into it. And so, I think of how do we prepare? How do we practice? I think of tabletop exercises. We need to be able to prepare if a vendor or third party goes offline. If our communications go offline, is it in our incident response plan? What have you guys seen recently, like from a practicing, exercising? Is it tabletops? What's your guidance to the folks that are participating today? Is it annual? Is it good enough for an annual tabletop exercise? I don't think so. I'd like to hear your thoughts.
I would agree with that. I think the tabletop is a good place to start because if the tabletop is successful, you're going to end up leaving there, and all of the attendees are going to end up leaving there with more questions than they had answers to, and that's a good thing. So it's going to be a catalyst for more discussions and for more tabletops and or more awareness of what does it mean for me. So look, when we're talking about all these cyber things, everybody tends to think, well, what do I need to care about that? That's something that IT takes care of. Those geeks down in the in IT department, they've got it taken care of. We got it covered. But you need to put it into perspective of what everybody, is kind of looking at it through their own lens. And you need to, they need to figure out what's in it for me, or what does this mean to me? And we need to try to facilitate them figuring that out. We need to, present things in a way that, we're not talking tech speak to them. We're talking to the finance person, and what does this mean for the financials of the organization? We're talking to HR, and what does this mean for how they're doing their jobs and how they're interacting with potential employees, and how they're working with the existing customers and the nurses, and how does this impact my patients? And this really is a patient safety issue. And, the full organization needs to understand that, cyber safety is patient safety, and it needs to have the attention brought to it that it needs, but they need to come from it, not from being banged with it. They need to come through it through their own lens of how they look at the world and how they interact with healthcare.
Right. Good. So, on that part, I got some questions coming in on the chats, and this one I think is relevant to what you just said, Rebecca. So, this is coming from Chris. Chris is saying, "How is patient care affected or can be impacted during a cyber crisis?" And when I read Chris's question, I'm thinking like, "Oh gosh, when I hear that ambulances are being diverted from hospitals or clinics, that scares me." So, like, what have you like? How do we address this from that concern and tying that back to the resilience and that patient care?
Oh, it absolutely can impact patient care. If you look at, I'm going to get geeky for a second. So you have the CIA triangle. So you have the confidentiality, integrity, and availability of data. So confidentiality is of course where you're talking about the privacy of the information, and patients want to make sure that they can trust you to keep that safe. Where it's really going to get into patient safety issues is the integrity and the availability of the data. If you can't trust that the data that you put into the system is the same data that's being pulled out, or that you can't even access it, that can lead to patient errors, to medical errors, because you're then making guesses. You don't know, is their meds list correct, or is their allergy list correct? So you may end up having to make medical decisions based on false or no information. So it's a huge patient safety issue. And that's just, looking at it from internally. Looking at it externally for the community, if an emergency department is on diversion, that means that if there is another emergency room in the area, in the community, that they are having to pick up the slack on that. And that means that they're having like twice the number of patients that are coming in, could be twice the number of critical patients that are coming in that aren't going to be able to be seen in a timely manner. And, same thing on the outpatient side, the outpatient clinic side. Just because they're not necessarily seeing emergent patients, they're still seeing patients that have major issues. And if they can't be treated, or if they can't be treated appropriately, that's kind of kicking that can down the road and making those issues potentially become larger.
Yeah, very good points. All right, so looking here, another question popped up, and this sparked my interest. This came from Stephanie. Stephanie's asking, "What is the average length and cost of a typical healthcare cyber incident?" Jeff, do you want to take that one?
Yeah, the reporting isn't great, so you could probably research this and find 10 different answers. Lengths can vary, as Rebecca will tell you, from sometimes minutes and hours to dealing with an incident, all the way up to weeks and even months in healthcare, unfortunately. As far as cost, one of the good sources of that is the IBM and Ponemon Institute study, where this year they reported that the average cost was $10 million for a cybersecurity incident in healthcare. So very impactful, obviously, and still driving a lot of financial issues for healthcare organizations.
Yeah. Yeah, I know that one is always hard to answer, but I wanted to throw that question out there. I think we have time for one more question, and then we'll get into some closing remarks. This next one is from David. He is a CISO, and he is asking about how, going back, I think, Rebecca, you started the security culture. Where do you start to build security culture within an organization? And he's specifically saying an organization of over 1,000 employees.
Well, the way that I look at it is that our culture comes from the top down. So you really need to make sure that senior leadership uh, understands the importance of information security, and that they are demonstrating the culture of security. If they are not on board with it, if they are not fully supportive of the decisions that are being made, the controls that are being put into place, there's going to end up being more exceptions to your policies than there will be actual, like, what you're following the policies. So um, that's really where you need to start. You need to start on education, making sure that that people have the information that they need. And you need to build that trust. You need to have that communication with the employees, with the staff. You need to make yourself visible across the organization. It's not just, the CISO cannot just stay in the IT area. You need to be able to, have conversations and collaboration across the full organization. Make yourself available for, coming to staff meetings or doing all of that and just building that trust so that they know that they can ask you anything, that you're not going to be, they're not going to get in trouble for reporting something that they've seen or that they've done. It's much better to know what's out there than to know.
Great. Yeah, thank you. And Jeff, anything else you would add on to that or complement?
100% agree with Rebecca. Really, it's around the culture of resilience, and that starts at the top. Having the right buy-in from senior leadership to drive cultural change is very important. Resilience is a team sport. It's the ultimate team sport, and everyone has a role to play. Draw any sporting analogy you like, whether it's the Olympics, soccer, football, anything really that's a team sport. You have to understand what your role is on the team, practice it, and be ready to perform. And that goes all the way from the board and CEO down to IT analysts, intake specialists, claims adjusters. Everyone on the team has a role to play when it comes to, a culture of resilience.
Yep. Yeah, I agree with that, definitely. All right, so I see there are still some questions coming in. Please keep them coming in. We will be collecting those. I like to give our participants here today last closing remarks. Jeff, what's the takeaway that I need to take home back to my organization from your perspective?
Yeah, thanks, Nick. I think the big challenge is coordination and communication, quite honestly. When it comes down to it, the technology systems can be configured and can be secured. Processes can be developed, people can be trained, but there has to be coordination and communication that has to come from the top. I think for a resilience program to be truly successful, it has to be led, coordinated, and prioritized from the highest levels of the organization. Why is that? Well, because when a large incident occurs, it's the highest levels that will need to lead through the very challenging environment and incident itself. So having that muscle memory and that practice, we mentioned tabletops. There are many ways to simulate an incident at all levels of the organization, but it's really organizational leadership has the responsibility, but also, the opportunity to lead the organization through that preparation and then be ready when the incident happens.
100% agree. Thank you. And Rebecca, last recommendations for the audience today.
Well, I will say, I think Jeff probably said that much better than I will ever say, but it comes down to building up that culture of security in the organization, making sure that everybody in the organization has the tools and the information that they need to be able to keep the organization cyber safe, and practice. You need to practice, and make sure that that everybody knows what role they have to play in it.
Great. Yeah, excellent points. As we discussed the need for critical preparation, proper incident response planning, and obviously the importance of tabletop exercises, in addition to running an out-of-band response, Sickness is an out-of-band platform for managing the end-to-end lifecycle of a cyber incident. Again, I want to thank our participants today, Jeff and Rebecca. And shortly, you will all receive a link to this webinar, plus information where you can learn more about Sickness. Thank you very much.